In comments on the videos, several of you have asked, what do I send to my laboratory technician in a veneer case? This is a Dental Minute video on fabrication of maxillary anterior veneers. The case is going to be a full mouth reconstruction. It will be in dentistrymasterclasses.com along with a video library and many other complete comprehensive cases. Hit the blue link in the description below and subscribe to dentistrymasterclasses.com. In this case, we're going to veneer the maxillary 10 anterior teeth. So I like to send a preoperative photograph to the lab, and this is after we've already placed the mandibular veneers. So I like to send a pre-op of the teeth to be veneered, in this case in comparison with the teeth that have already been veneered. I want to send this photo to the lab technician, and it lets the technician confirm the face bone mounting. So this arrangement of the teeth, this alignment in relation to a line drawn between the pupils of the eyes, which represents the lab bench and the floor, should be the same as the alignment of the mounted stone model on the articulator with a face bow. So this photo always goes to the laboratory technician so he or she can confirm that the face bone mounting is correct. This is the maxillary veneer provisionals with the lips in repose. Now she's not smiling because her lips are numb. You could take one several days later with the patient smiling and when their lips are not numb, but this is just to show the provisional alignment that the centrals are the longest teeth, that the incisal plane parallels the lower lip, and that the incisal plane of the centrals with the provisionals is parallel to the eye line or the pupillary line, and that goes to the laboratory technician. This is just the maxillary provisional veneers versus the mandibular veneers, the seated veneers in the mandible, and these are the other things we send to the lab besides photographs. This is the first model taken in my office with reversible hydrocolloid, and we pour that model. We take a second model with a polyether and custom tray. This is an impression and model, stone model of the provisional restorations, and the incisal plane of the provisionals should be good. It should be the approximate length of the final restorations. The laboratory technician should be able to use this model as a guide for the length of the final restorations. Then an opposing model, and this is a face bow. So here's the polyether with custom tray impression. It's the second impression we take, and we don't pour this one. The lab pours this one, and from that he fabricates the dies. So this is the tooth preparation model poured from impression number 1, which is a reversible hydrocolloid impression. Now those have to be poured within a couple of hours, so we pour that model in our office. And you can use this for a solid model for perfecting the interproximal contacts, or if there was any question about the first impression, you've got a second impression to compare to. Then this again is that first tooth preparation model poured from impression number 1. And then this is a model of the provisional crowns and veneers. And so we take an impression of the provisional restorations once I have the length exactly where I want them. The incisal plane is ideal. We take an impression of those and pour this model, so the laboratory technician has this as a guide for the final restorations. You can see the centrals of the longest teeth, and this incisal plane blends seamlessly into the occlusal plane. Then this is the opposing arch model, and then this is an occlusal registration record taken only between the teeth that are being crowned. There's anterior coupling of the teeth being veneered, meaning the lower teeth contact those. So you don't want to take an occlusal registration record there. Take it only between the teeth that are out of occlusion, and that would be the bicuspid teeth which are being crowned. Then either I or the technician will trim these occlusal registration records back, so there are only cusp tips in the occlusal registration record. If you leave it like this and mount the models like this, your occlusion is always going to be high. Then this is a face bow mounting. We've mounted the face bow bite fork on a stone mounting jig, and we send this to the lab, and then he can remount the case with his articulator in the laboratory. This is a shade, this is an OM1 taken of the veneers that have already been seated, and I want the technician to match the maxillary veneers to the mandibular veneers. So I'll either use this shade guide, which has multiple shades, including bleach shades, or I'll make a custom shade tab from composite. And then the seated mandibular veneers, and hopefully your technician has made a note of the mixing of the restorative material, whatever he used and how he used it to fabricate the opposing veneers, so he can use that same mix or material to fabricate the maxillary veneers. Then this goes to the laboratory technician. 4, 5, 12, 13 tooth-colored crowns, 6 to 11 veneers. Now, if you're using a new technician, you may want to tell him what materials you want him to fabricate the veneers and the crowns from. Either Emax or porcelain to zirconium or all porcelain. I've worked with my technician so long, we know the materials. And then I'm also sending a face bow and a bite record. Shade, match the lower veneers, B1 plus, ideal, like Sharon and Janine. These are 2 other cases we've done that he's very familiar with that were ideal, and I want to make them the same shade as those cases, but also to match the lower veneers. That's why we're sending photographs with a diagnostic camera that's very accurate. You don't want to send a cell phone shot. You want a very accurate high-end camera to take the photographs so that it's as if the patient were sitting in the laboratory with the laboratory technician. That's the dental minute. These techniques work, and they work every time.